Hello, and welcome to another episode of Insights. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Our hope is that these episodes serve as a resource for the advancement of your career and the continued success of your team. Now, on to the show.
Today on Insights, we go back to a conversation host Bill Russell had with Amy Maneker, the Physician Executive Advisor, Arch Collaborative at KLAS. The topic of discussion was the Arch Collaborative, user satisfaction, and optimizing the EHR. And Bill asks Amy, what have we learned about working together to revolutionize and improve the EHR experience?
The last time you and I got together, we talked about the Arch Collaborative. In fact, you introduced me to the Arch Collaborative. I went on to have Taylor Davis on the show, and several other people have come on to talk about their results around the Arch Collaborative because it has done so much good work within the industry. And you talked about IT spend, voice recognition, scribes didn't correlate to user satisfaction. And we talked about that a little bit. Then you shared how personalization, training, and ongoing ownership and engagement were the keys to satisfaction. That was 2018. What have we learned since then?
So the three tenets that come out of the data. So there have been the Arch Collaborative. Let me back up. One, I'm not going to call it burnout. I'm going to call this user satisfaction because I think physician burnout is a much bigger topic. And for the bigger topic, I look to the experts like Stanford and Tate Shanafeld and all the components. But I think the EHR plays a role in burnout. Sometimes it's because it's part of the cause, but sometimes it's a symptom of the disease. So if there's more regulatory requirements put on the physician, you'll see it in the EHR, so they'll blame the EHR. Or if the physician is asked to be doing all these mundane tasks that really could be offloaded if we did team-based care, they'll feel it in the EHR. So I don't think you have to separate it out. And so then I try to talk about user satisfaction in the EHR because I think that's more what we can focus on. The Arch Collaborative is just one tool. There are many organizations who are addressing user satisfaction and may or may not be using the Arch Collaborative. What I like about it is it's a survey tool. And it basically says, hey, does your EHR allow you to provide quality care? And if so, why or why not? What are the components? And the three components, despite more data than 2 years ago, much more data, still hold true. Training/education, personalization, and what I call shared ownership. They have different terms for it. I think it's mastery. I'll get you the exact terms they use. It's strong user mastery, shared ownership, and EHR meets unique user needs. So strong user mastery is education and training. Shared ownership is ownership and engagement. And EHR meets unique user needs is personalization. Whether you do the Arch Collaborative or not, or get this data, I think that is becoming more standard understanding. So Judy Faulkner recently spoke at a forum at the Cleveland Clinic called Ideas for Tomorrow. And somehow it's been all over. I actually saw it because I'm connected to the Cleveland Clinic. But what she mentioned there has been seen everywhere on Twitter. And she even talked about, hey, you have to have ongoing education. And she talked about personalization. She talks about shared ownership they're very specific. They have one flavor of it at Epic, or they have one term, physician builder. I think there's many more ways to do physician ownership and engagement beyond the builder. And that can be vary between organizations, and it can even vary within an organization. So the orthopods may have a physician who's involved in a certain way, and the primary care providers may have a different. In fact, one of my compatriots says, we don't use the title physician builder, call it EMR director. One of the tools they can use is being a builder.
Do you find that clinicians generally understand all the things the EMR can do? I mean, that's one of the things.
No.
Yes. So it's interesting because the EMR can do a bajillion things, literally. And what I find a lot is IT organizations struggling because a physician wants to bring something in and they're like, you realize that our EHR has that module or has that capability or those kind of things.
Not uncommon when people ask for an optimization, I'm using air quotes. Let me speak two things, but it's actually there. But the other common thing in informatics is we need to focus on what they're trying to achieve, not what the user says they want. Because what they says they want is not necessarily the best way to achieve it, or the software isn't going to do it, or that's not really what they want. So someone recently said on a podcast, let the experts do their job. It's like, get the CMIO, get the physician informaticist in there in the conversation. So you can say, I want, and I can give a great example of this. I want something, and they're like, what are you trying to achieve? We can do it this way. So yes, we commonly see that what someone wants in optimization, it may even be there, but then if you say to them, what are you trying to achieve? The way to achieve it is there.
I want to thank Tracy for another great episode. If you have feedback regarding the content and materials that you just heard and would like to help us to amplify great thinking to propel healthcare forward, please send us a note at hello@thisweekinhealthit.com. Thanks for listening. That's all for now.